Hello, my name is Javier Guaman Lema. My topic to talk about is refining antithrombotic therapy for atrial fibrillation and acute coronary syndromes or PCI. Definition. Thrombosis is the formation of a blood clot, known as thrombus, within a blood vessel. It prevents blood from flowing normally, drawing the circulatory system. This can lead to very serious conditions and even because of death. The antithrombotic therapy be used with atrial fibrillation or acute coronary syndrome undergoing PCI percutaneous coronary intervention.
Your heart is a muscle that pumps blood around your body. It's made up of 4 chambers, 2 at the top called the atria, and 2 at the bottom called the ventricles. Your sinus node sends out electrical impulses. Atrial fibrillation, or AF for short, is when other areas of the atria send out electrical impulses too. These irregular impulses cause the atria to twitch. When this happens, blood isn't pumped out effectively, which could cause a blood clot to form. If this clot travels to your brain, it can lead to a stroke. When your heart isn't pumping blood properly, it can lead to symptoms such as tiredness, dizziness, or feeling faint, shortness of breath, or palpitations. How AF affects you will determine the treatment you need. Some people with AF, like Harry, only have mild symptoms, or may not experience any symptoms at all. Harry noticed something might not be right when he felt his pulse was irregular, and sometimes fast. Harry was at higher risk of AF because of his age and high blood pressure. Those with a heart valve problem are also at a high risk. It's important that Harry avoids further strain on his heart by getting treatment for his AF to reduce his risk of stroke or heart failure. The best course of treatment for Harry was anticoagulant medicine called warfarin to reduce his risk of having a stroke, followed by a cardioversion to try and restore his normal heart rhythm. However, some people may need other treatment, such as ablation or other suitable medication. Thanks to his treatment, Harry's AF is manageable and he can return to work and exercise when he feels ready. For more information on living with atrial fibrillation, visit bhf.org.uk/AFib. BHF. Beat heartbreak forever.
Acute coronary syndrome, or ACS, is the leading cause of death globally. The spectrum of ACS ranges from unstable angina to non-ST segment elevation myocardial infarction and ST segment elevation myocardial infarction. Ultimately, ACS is the result of an obstruction of the coronary arteries induced by an atherosclerotic plaque. ACS events are triggered by the plaque rupturing. This exposes subendothelial matrix proteins and other molecules. Platelets are recruited to the site, adhere to the injury, and, together with red blood cells and fibrin, begin to form an arterial platelet-rich clot. This narrows and eventually obstructs the coronary artery. And the location of the blockage and the resulting myocardial damage determine the extent and the severity of the myocardial infarction. Life-threatening arterial clots are formed through 2 pathways: activation of platelets and generation of thrombin by coagulation factors. Targeting both pathways has been shown to be a viable therapeutic approach.
Coronary artery disease is narrowing of the coronary arteries secondary to several risk factors, some of which are cigarette smoking, hypertension, hyperlipidemia, and diabetes. Percutaneous coronary intervention, or PCI, is a procedure used to treat and evaluate partially and completely occluded coronary vessels. Atherosclerosis results from endothelial injury, inflammation, and accumulation of lipoprotein, leading to endomal deposition of particles and narrowing of the coronary artery. The stenotic vessel makes it difficult for red blood cells to pass through. Therefore, the risk of ischemia and infarction is increased. During a percutaneous coronary intervention, an incision is made to isolate the femoral artery. A catheter is inserted into the artery and guided up the aorta to the heart. Live angiography is used to guide the catheter up the aorta to the heart. Live angiography is used to guide the catheter to the obstructed coronary artery. Radiopaque dye is injected into the artery. Imaging determines the location of the stenosis and the diameter of the vessel. Once the vessel is isolated and the obstruction located, a guide wire is threaded through the catheter to the location. The catheter is removed, leaving the guide wire. A balloon catheter is pushed over the guide wire and centered over the blockage. The balloon is inflated to open the narrowed vessel. The balloon is inflated and deflated multiple times to gradually widen the occluded vessel. To ensure that the artery remains unobstructed, a second balloon catheter with a stent is threaded to the location. The balloon is inflated, expanding the stent. For some patients, drug-eluting stents are used to decrease the chances of instant stenosis. Drug-eluting stents are coated with a material that will retard new intimal hyperplasia. Blood flow through the coronary artery is restored.
Application in nursing. Thrombolysis causes in medium procoagulant response of finish the infuse, with the consequent prolonged thromboembolic effect. The trigger appears to be exposure and drug contact in the particularized thrombus that activates the platelet and ensures coagulation cascade.
Triple antithrombotic therapy is the standard of care for patients with atrial fibrillation undergoing percutaneous coronary intervention, or PCI, with stenting. Oral anticoagulation and dual antiplatelet therapy with a P2Y12 inhibitor plus aspirin are used to prevent thromboembolic events, including stroke, systemic emboli, and stent thromboses, but they are associated with a high risk of major bleeding. A potential therapeutic strategy to reduce thromboembolic events and bleeding risk is dual therapy, with the oral direct thrombin inhibitor dabigatran and a P2Y12 inhibitor without aspirin. In the multicenter randomized redual PCI trial, 2,725 patients with non-valvular atrial fibrillation who had undergone PCI with stent implantation within the previous 120 hours were randomized to receive either triple therapy with warfarin, a P2Y12 inhibitor, either clopidogrel or ticagrelor, and aspirin for 1 to 3 months, or dual therapy with dabigatran, 110 or 150 milligrams twice daily, and a P2Y12 inhibitor. The primary endpoint was time to first major or clinically relevant non-major bleeding within 14 months. The rate of major or clinically relevant non-major bleeding was 15.4% in patients receiving 110 milligram dabigatran dual therapy, as compared with 26.9% in patients receiving warfarin triple therapy. Similarly, the rate of major or clinically relevant non-major bleeding was significantly lower in patients receiving 150 mg dabigatran dual therapy than in those receiving warfarin triple therapy. In the secondary endpoints, there was no significant difference in the rate of thromboembolic events or death between patients receiving 110 or 150 mg dabigatran dual therapy and those receiving warfarin triple therapy. The authors conclude that in patients with atrial fibrillation after PCI, dual therapy dabigatran and a P2Y12 inhibitor significantly reduced the risk of bleeding as compared with warfarin triple therapy, with no increase in thrombotic complications. Full trial results are available at nejm.org.
Issue applied in Ecuador. Anti-resistant interventional cardiology were regular to perform a coronary catheterization involving anticoagulate patients. The radio approved and the daily problems of patients with AF, with change in anticoagulant therapy have left the more frequent usage of PCI in patients in when anticoagulant in continuance with the usage of brigadier therapy with heparin. Given the increase of thromboembolic and hemorrhagic risk that this entails. Pros and cons. This type of presentation is frequent in this population due to hemodynamic deterioration caused by right IF, ischemic anemia, or even coronary embolism. Invasive strategies were required achieved in the antithrombotic medication regime, thus this longer duration of the combined implanted therapy was always associated with higher incidence of hemorrhage after evaluation examination of HK, a conservative strategy for same patient combined evaluate.
Pros and cons of medication versus ablation for atrial fibrillation. Compare two options for atrial fibrillation treatment to improve your quality of life. If you're one of the 2.7 million Americans who live with atrial fibrillation, a tricky-to-treat condition that causes your heart to beat irregularly, you may be unsure how to treat it. Symptoms of atrial fibrillation, also called AFib, can be debilitating. They may include palpitations, shortness of breath, fatigue, and weakness. But trying to reduce these symptoms through drugs that control the abnormal heartbeat, called antiarrhythmic drugs, can come with serious side effects. Another treatment option is catheter ablation. During ablation, the abnormal heart tissue is destroyed by burning or freezing it. Ablation has a greater chance of reducing and even eliminating your symptoms and making you feel better.
Conclusion. Patients with AF treated with STAC are a high-risk population with high comorbidity. In recent years, several strategies have been processed, supported by expert consensus documents are reducing the risk of hemorrhage without increasing the risk of thrombosis.
In conclusion, longer door-to-balloon time in coronary intervention for myocardial infarction is related to higher risk of adverse outcomes. Minimizing this delay should remain an important part of the quality improvement effort. This is especially important in settings where door-to-balloon delay remains significant, because pre-hospital delays modify the effect of door-to-balloon time on outcomes. Improving this segment of the delay chain should be further emphasized.